You know, I think I saw a picture of one of those. Okay. All right. Okay, good afternoon, everybody. My name is Peter Zanoni. I'm Corpus Christi City Manager, and this is our daily press briefing on COVID-19. Today is Monday, what did it say, the 13th, so we've had the weekend, and this begins a new week. We're hoping it's a better week than last week in terms of testing and deaths and that type of thing. I'll be presenting here first this afternoon, and then Annette Rodriguez, our Public Health Director, is going to do a Skype or WebEx from a remote location. And then Nueces County Judge Barbara Canales will be joining us today as well, and then Mayor Joe McComb will be here as well to speak. Now, we know that we have listeners and people that follow, and we appreciate the community watching. This is important information. And today I want to speak particularly to teachers and parents that have children or themselves returning back to school. And so just about an hour ago, Mayor Joe McComb and myself and Nueces County Judge Barbara Canales had a WebEx with 6 of our superintendents in the area to talk about that very issue, that being, what about school and the start of school, and what's that going to look like for students and for parents and for teachers and for sports lovers and so on. And so the good news is that we're working collectively, and I think all 6 superintendents expressed that sentiment, that they were glad that we had made that call to talk as a community about how to deal with the next very important event, if you will, that we have to deal with when it comes to COVID-19, which is the beginning of school and getting our children back to learning. And so we know that as a community, we've dealt with Memorial Day, we've dealt with summer, we've dealt with holidays like the 4th of July, we've dealt with the desire to get to the beach and how restricting access is best for the common good. So the conversation that we're going to have with the superintendents for the 6 school districts in the city of Corpus Christi will be, I think, a beneficial one. And the mayor is going to talk about that today in particular. And but just to let the community know, we've begun that conversation. Some of the schools, 2 of the school districts have a year-round calendar, and some of their classwork begins soon. So, and then the other 4 have a more traditional calendar, but some of their start-up dates are just right around the corner. And so we'll continue to work with the superintendents this week, and we'll work together to inform the community on the approach when it comes to getting ISD employees back to work. What would that look like? And then get parents and their children back to school, and what does that look like, whether it's remote learning, classroom learning, and so on. We also talked about sports, and so we know there's things like band, football, volleyball, soccer potentially, and some of the districts are making decisions on that as well, so we should have some information to help the community there as well. We, the city, does not control the school districts, right? That's an independent governing structure, but we want to work with them and work with the community to make sure everybody's kind of on the same page when it comes to school. Okay, so with that, let me tell you just quickly about some of the statistics for today. And so we're going to put up our graph on the number of new cases. And we're glad to see that we have a smaller number today than what we had last week, Monday. So last week, Monday, and Mondays can be somewhat of a lag because of less testing over the weekend. But this Monday, we have 253 additional new COVID cases. It's a little bit higher than yesterday, Sunday, which was 209. But as I mentioned, it's less than last Monday when we had 288. And it's also much below our 7-day average, which is 335 new cases every day. That's a 7-day average, 335. So 253 is a little bit better, and we'll see what happens during the rest of the week. This is our donut chart here. The next chart shows the number of active cases in relationship to the recovered, and this is still pretty high for active cases. 91% of all the COVID cases in Nueces County are active, and so a little over 5,800 active cases. We have 566 cases of recovery and then 58 deaths, and I'll go over a chart on deaths here in a moment. This trend line looks a little bit decent here, and we're not sure if this is the beginning of the turn of the curve or not, but with today's information on fewer cases is also corresponding fewer hospitalized patients than yesterday. 331, which is 2% less than yesterday. You can see the lines kind of bending a little bit, and we hope that continues. The number of persons in the hospital but that are being treated in ICU also decreased by 4 persons, so it's down to 96. And then the number of deaths went up by 4 since yesterday. So yesterday it was 54. There were 4 new deaths today, and so we're at 58. But you can see even that line's beginning to turn just a little bit instead of going straight up as it was doing last week. And then this shows our more long-term look at the number of daily average cases and then the running 7-day average. So you can see the curves beginning to turn a little bit, and that's reflective of the weekend. And so as I mentioned, you can see the bars here, the single days. That 7-day average is dropping a little bit to 335 cases. And so we hope that's the beginning of the turn. We can't let our guard down, though. If you recall some of the message points from over the past couple of days and weeks, which is that interventions like closing access to beaches or closing bars or restricting access to restaurants from 50% to 25% takes about 12 or 10 to 14 days to have an impact, about 2 weeks. And so it's been about 2 weeks since some of those interventions were put in place. And so this week will be critical in measuring what's happening here with the number of cases. We hope that this turning is something that will be sustained through the week. But still, we have to be mindful of how to prevent COVID, how not to get it. And remember all those interventions that we've talked to you about, to include wearing a face mask, and even with the face mask, staying 6 to 10 feet away from persons, and staying at home as much as you can, and keeping your hands washed, and keeping dirty hands off your face. Those are some of the basic ones. Okay, so that concludes my presentation. Gabby is here today. She's going to translate into Spanish, and then Annette Rodriguez will come up from a WebEx.
Las cifras más recientes indican que en las últimas 24 horas se han reportado 253 casos confirmados por el coronavirus, haciendo un total de 6,427 casos. 566 de esos casos se han recuperado por completo, 331 personas están hospitalizadas, 5,803 casos continúan activos. En promedio, diario por el coronavirus, en casos positivos es de 353. A la fecha se reportan 58 fallecimientos. El día de hoy tuvimos una junta con los superintendentes escolares del área para escuchar su opinión en cuanto al regreso a clases. 2 de los 6 distritos escolares de nuestra área cuentan con clases todo el año. El resto cuentan con clases tradicionales. Vamos a continuar trabajando con ellos para decidir qué pasos tomar en cuanto a las clases y el próximo año escolar, así como los eventos deportivos. Así que ya le tenemos información de las decisiones que las escuelas tomen.
Good afternoon. Annette Rodriguez, Public Health Director. As mentioned earlier, we had 4 more deaths today of COVID-19. Our sincerest condolences go out to their family and friends. Our next drive-through for the health district testing will be tomorrow, as well as again Wednesday and Thursday. If you are continuing to have symptoms of COVID-19, please call 826-7200 to get scheduled for our drive-through. When COVID-19 first emerged in Wuhan, China in December, it was a virus that was thousands of miles away, affecting an unknown number of people. The cases spread into Asia and other countries, and still we all saw it as very far away. When the first case was announced in Washington State, it seemed to come a little closer, but still we all thought it was far away. And then it came a little closer, and it was here in Texas. in early March. And then on March 21st, 2020, the first case was reported in Nueces County. The virus was definitely here. At that time, the risk of contracting the virus was considered very low because our numbers were low. Now, with over 6,000 new cases in Nueces County, it is affecting someone whom we either know personally, work with, or know someone who knows that positive case. Some have mild symptoms, while others have severe symptoms. Some have recovered, while others never will. The way the virus will affect a person is unknown, so taking chances with the health of yourself and your loved ones should not be an option. The number of deaths due to COVID-19 is increasing dramatically in Nueces County and in Texas as a whole, and the story of those who died are emerging. Every life lost is a precious one, from the youngest to the oldest and those in between, to those who spent years together and to those who were planning to spend a life together. Every life lost has a story. Can the trajectory of a continual increase in deaths be changed? I'd like to think that it can, but only if we all can work together to help save each other by helping to reduce the spread of COVID-19. It took our entire community to get here, and it will take our entire community to get us back to where we control the spread of the virus. The transmission of COVID-19 is, as Dr. Bird says, a domino effect. Stopping one individual from spreading the virus can help reduce the spread. It starts with each of us doing our part by staying at home, wearing our mask when out in public, and social distancing 6, 10, 15, 20 feet as far apart as possible. It means we may have to forego some of our plans, some of our events that we're all wanting to go to, or modify them in such a way as to not increase our chances of contracting COVID-19. It means that we must take a stand and make a conscious decision to take all precautionary measures to help reduce the spread. COVID-19 is everywhere. It's in our workplace. It's in our churches. It's in our hospitals, nursing homes, and assisted facility living areas where some of our most vulnerable populations are. It's in our jails, grocery stores, malls, and it's even in our home. COVID-19 is everywhere. Now is the time to act. Continue to be vigilant about washing your hands. Avoid people who are sick and disinfect frequently touched objects often. If you are sick, do not go to work. If you have COVID-19, do not go to work. If you were exposed to someone with COVID-19, do not go to work. Stay at home, and I pray that you may be one of those that recovers. The health district phone banks are a terrific group of public health servants, but their job is getting much harder. Last week, I received a message from the phone bank that a priest was calling, asking about processes for handling the deceased. This is his story. He had a couple that was going to classes with the church to get married. The young couple both got COVID-19, and now he found himself about to conduct a funeral for the young bride-to-be instead of the wedding they were preparing for. This past weekend, the fiance, the groom-to-be, in his 30s, passed away also from COVID-19. These are horrific stories of what is happening in Nueces County, but the only ones that can change the end of these stories are ourselves. Make responsible decisions. Stay strong, stay well, and as always, stay informed. Thank you.
Como le mencionamos, tuvimos 4 muertes adicionales el día de hoy. Le damos el más sentido pésame a los familiares y a los amigos. Cuando se descubrió el virus en China en diciembre del año pasado, pensamos que estaba muy lejos de nosotros. En marzo le informamos del primer caso en nuestro condado. Ahora, con más de 6,000 casos, casi todos nosotros conocemos de alguien que dio positivo. El número de muertes debido al virus sigue incrementando en nuestro estado y cada persona fallecida tenía una historia. Pero nosotros podemos ayudar a disminuir el número de muertes y comienza con nosotros, estando en casa o utilizando el cubrebocas o estando a 6 pies de distancia de otras personas o cambiando nuestros planes. El virus está en todos lados, en nuestra comunidad, en las tiendas, en las cárceles, aún en nuestros hogares. Desinfecte las superficies que son tocadas constantemente. Si usted contrae el virus, espero que se recupere. Tome las decisiones lo más responsable posible.
Good afternoon, everybody. Barbara Canales, Nueces County Judge. I'm going to go over some of the finer points of our talking bullets from last Friday because I think they really highlight a good way to start the week. My theme today is resources arriving, more on the way. I want to share with you about some of the good things that are happening as well as some of the bad things. On Friday, I did extend my order regarding facial coverings and masks to align with Governor Abbott's proclamation extending the statewide disaster declaration for a 5th month. And we went over that on Friday. And I said we had to think of these terms as a marathon, not a sprint. Well, I might have to alter that metaphor. I think I'm going to turn us into an Ironman competition where there's running and swimming and cycling. And the reason I say that is because some of us are good swimmers, and some of us are better runners, and some of us like to cycle. But one of those three should be a challenge for us. And that's what we find ourselves in right now, is the greatest challenge of our lives. Because as we enter the 5th month of the coronavirus pandemic, things have taken a dramatic turn for the worse here in Nueces County. And last week, we had a record number of positive tests, patients in the hospital, patients in the ICU, and patients who had died. And on Friday, I asked that everybody do their part to combat the spread of this virus as best we know how, washing our hands, social distancing, staying at home, and wearing face masks. And that I would have updates to share with you on Monday. And I'm going to pause right here, and I'm going to say that even though the statistics for this day, one day, look a little better than they did yesterday, I'm not pleased. And I'm not optimistic about this week because I already know how many people are in the hospital right now. I know how many people are fighting for their lives in ICU right now. I know how desperate it is because today a federal team of ICU nurses and respiratory therapists, a group called a DMAT group, arrived here at Crestes Pond Shoreline. Do you think that it is business as normal and that COVID isn't affecting us if the federal government sent us this type of crisis medical team? No. We are in terrible crisis right now, and I'm sorry, but the fact that we had lesser deaths than yesterday and lesser positive cases does not change the fact of what's happening at Crestes Shoreline, at CCMC, and throughout Nueces County's greater extended area in our regional hospitals. And I need you to know that. And I'm grateful that our numbers are less than yesterday. But I also know how many people we tested over the weekend, and we are going to be getting those tests in a few days. So that the story is yet to be told. I want to see where we are on Friday. And so I spent the weekend and all day today working with regional and state officials to get the resources that we need. And I want you to know, this is the proactive part, what we're focused on. First, supplies. Early on, this was an issue and cases have gone up. And so guess what? No big surprise, we need supplies again. These range from PPE to testing supplies to medication. The second piece is facility resources. Last week, we were concerned that we would run out of some space in our medical examiner's office, and we were worried about the 17 regions that we serve. And so the medical examiner asked me to submit a STAR request for a morgue trailer and we did, and some supplies that he needed. In addition, I have a COVID clinic that I'd like to outline for you, as well as renew the urgent need for an alternate care site for 40 additional ICU beds. Medical staff is another arena. We have had the help of the Texas National Guard, as you know, to do all of this drive-through mobile testing. And we had the pleasure of feeding those guardsmen, men and women, also with a TETM team from Laredo this weekend at the fairgrounds. Just want to say thank you again, Lieutenant, and to the teams that were there that took care of our citizens. We had 16 initial requests of staff from CCMC. They have over 40 that they've received. We had an initial 40 that were received at Christus Spawn, and then today we had another 38 that were deployed, last week, and then we had the DMAT team that came in today. Today, the governor announced that the United States Department of Defense, the DoD, has activated additional United States Army Urban Augmentation Medical Task Force. This is in order to help us combat COVID-19. Again, this is your red flag. This is happening in your state, in our home, in your backyard. Not in New York, not in Florida, not in Louisiana, right here. Right here, our state has called in the United States Department of Defense. So this is our wake-up call right now. One, by the way, of these teams is in San Antonio, and they've been there since July 6th, and then one arrived in Houston, Texas today. Four more of those types of teams, the UAMTFs, along with the U.S. Navy Acute Care Team and 4 U.S. Navy Rapid Rural Response Teams will be deployed to additional locations across Texas. And of course, they're going to identify their ongoing assessments and assignments as needed. These teams are medical and support professionals which are being deployed to support medical needs in hospitals throughout the state. We here in Nueces County are actively engaged with the state of Texas as part of those ongoing assessments to ensure we have access to these resources. That's what we proactively are working on. There are many, many military resources, and we want to make certain that we can find the right resource and marry it with the right need. So we have discussed, as you know, we talked about it on Friday, getting a formal request in for the USNS Comfort to come to the port of Corpus Christi. We have spoken to United States Senator Cornyn's office. We've reached out to our military prepared commissioners that are from our region. We've talked to the governor's office. We have talked to Chief Kidd and everybody in between, from legislative delegations to the CO of our Navy base here, all in an effort to understand if this ship would be the right type of resource for our geographic region. I can tell you that if nothing else, we can ask, and we can highlight the priority that should be the Gulf of Mexico. If you remember the graph that always comes up, there's a straight line having to do with hospital capacity. This is the graph that usually Dr. Bird shows, and he always talks about hospital capacity. And then there is the curve, and that's the infection rate. And how if we do certain things, he's always telling us, like social distancing and mask wearing, how we can really bring down that transmission rate, that R naught factor. And we could flatten the curve. What I'm trying to do is give us that straight line. So all the actions that we're taking in EOC is to get that line straight again. Unfortunately, as much as I want to raise the bar, looks like we're heading straight up. But as we work to raise the bar with all of you, I need your help more than ever. Whether it's a triathlon like I mentioned or just a regular old marathon, one thing's for sure, time is involved. And each of us can make a difference as Texans. So let me share with you what I think we really need. We need to make certain that this COVID clinic becomes a reality. And we're going to work very hard to make sure this happens. It will be a free clinic for active COVID-19 patients staffed by our own backyard doctors here at Nueces County medical professionals who would give of their time voluntarily. And we would help bring this to fruition with the help of our city and our county's emergency operation command centers, and we will ask for additional resources from the federal government through these military staffs that are being deployed. There are lots of medical field personnel in the state of Texas, and this is a major disaster, and we need their help. So that's one piece of it. Why are we doing that? To suppress the amount of people that would otherwise have to go to the emergency room or hopefully prevent a hospital stay altogether. I want to go on record today renewing my urgency, as we said months and months ago, for preparedness and setting up Memorial Medical Center as an alternate care site for 40 beds. If we have learned nothing from these last 2 weeks, is that in a blink of an eye, over a holiday weekend, graduation weekend, the start of summer, and getting back to business, that we can go from here to here. My dad always told me that you're nobody unless you make the New York Times. So I've always thought to myself, we really want to make the New York Times. We made the New York Times for all the wrong reasons. We made every major newspaper in the country for all the wrong reasons. Nobody wants to be number one in growth. So I'm sorry if I'm not here towing the company line to say that we did great today. This is our wake-up call. These federal teams coming here is our wake-up call. And so I must tell you that this weekend I was disappointed. I was disappointed to see our beaches thick again. I was disappointed to see videos of bar fights on a Sunday morning. I was disappointed to see gatherings when permits had been denied on our bayfront. I'm disappointed because these are the things that we don't do when we're in crisis. And so I am going to do something that I never thought ever in my life I would say. And that is, I'm going to ask Texans to give us some coastal distance. Now, of course, if you have a home here and a wonderful place on the beach, that's your place. You have a right to be here. But if you're coming to day trip here, you need to think about coming when we're not in crisis. We need to stabilize and we need to level off. Otherwise, this whole summer will be gone for all of us. Please, I am personally going to reach out to Harris County, San Antonio, Bexar County, Dallas, and everybody in between that loves to come to the coast. And I know why. We love it too. And on any other normal summer, we would welcome you with our open arms and thank you profusely for helping us. But our survival right now in the health of our hospitals depends on this coastal distancing. When the coast is clear, we're going to let you know. And we're going to have you come back, spend your money, enjoy everything that's wonderful about the South Texas beaches. But right now, we need to level off. And so, from our friends in Port Aransas to Padre Island, we need to make a better effort than we did this weekend. And as a result of this weekend and as a result of our crisis, I will be visiting with the General Land Office this week again to understand, so that they can understand where we are and understand that number one, in this particular criteria, the number one in cases in the nation is not a number one I ever want to see again. And we will do everything we can in emergency management to drive that number down. And so, please join me in renewing everything, our faith, our ability to do what's right, and to get really serious about this. I want to leave you with this thought that a great senator once told me, and He said, people don't really care about what you know, Barbara. They want to know that you care. Well, I care. I really do. I hope you can see it in my eyes, even with this mask on, how much I care about this community. And because I do, I'm willing to do everything I can to stop one more death. Because it's too many. It's too sad. It's just absolutely within our power to correct it. But I cannot do it without this community's commitment to getting it right. So do not be happy about today's numbers. Be sad about the number that reflects the amount of deaths, the amount of hospitalizations, and the fact that we had to call on the United States government to come and help us. Reflect on that. Feel it. It should make every bone in your body hurt. And the only way we're going to get through it is if we stop doing the things that are hurting us. So, I'll answer questions. We've been answering questions all day about what we're going to do about some other things like schools and, how we're going to, figure out how we're going to create these alternate care sites when staffing is so limited. Let me just say that our plan is to identify federal resources for staffing. We know that the hospitals cannot staff it. We understand that. So we know that if we create this 40-bed unit, that we would have to look for outside staff to come and run it. But if it's your loved one needing that bed, I promise you, it's better to have it than not to have it. Thank you. Yes, sir. So I'm glad you brought that up. So today there was a big meeting of superintendents, and I personally spoke with Dr. Hernandez and told him I do favor a later start date given the crisis that we're in. But I told him the truth, which is that I really need guidance from the state as to whether this decision is in our local hands. I told him that I would do what I do on every subject matter. I ask for guidance and for the ability to have authority. If authority is given to the locals in this parameter, in this arena, I think that it's the will of all the superintendents and the will of the Teachers Association to have a later start date. That doesn't mean we're not going to school. It just means that we need to get over this particular crisis that we're in and create a workable solution for our children's education and their future. This is the worst time ever, for example, for some of our school districts who do year-round school who are going to start mid-July. How could we possibly start in mid-July if we are the number one city/county in the nation for COVID growth? I mean, this is unrealistic. So again, we're going to reach out. We had a great conversation today, and I told the governor's office that I stand ready to work with them and to work with the state of Texas to make certain we can keep our community safe and create a working relationship so that everybody feels like they can they can teach safely as well.
En resumen, en cuanto a los recursos que esperamos obtener, le tengo más información. Ya entramos en el 5º mes de la pandemia y la semana pasada rompimos varios récords, desde personas fallecidas hasta hospitalizaciones. Aun cuando las cifras de hoy son menores que ayer, no tengo optimismo, porque sé que aún hay pacientes en el hospital y el gobierno federal nos ha enviado un equipo especial de especialistas a nuestros hospitales. Me da gusto que las cifras hayan disminuido, pero aún falta más por hacer. Continúo trabajando para obtener más recursos, desde equipo personal para realizar pruebas. También buscamos un área alterna para tener 40 camas adicionales. Continuamos recibiendo personal para realizar más pruebas, gracias al despliegue de más personal de la Guardia Nacional. Estas adiciones solo significan que nuestros casos siguen altos y necesitamos de más personal. Los equipos son médicos, especialistas y técnicos. Asimismo, continuamos solicitando el buque USS Comfort, el cual cuenta con 1,000 camas adicionales, esperando que ese buque pueda darnos el apoyo que necesitamos. Trabajamos con el senador Cornyn esperando respuesta pronto. Más que nunca necesito de la ayuda de ustedes y cada uno puede hacer una diferencia. Continuamos trabajando por obtener la clínica solo para casos activos por el COVID y gratuita para aquellos pacientes. Esta clínica ayudaría a que los hospitales no estén al límite de su capacidad. Me dio mucha decepción ver a tanta gente en las playas y peleas en los bares. Yo personalmente me voy a dirigir a otros condados del estado para pedirles que ahora no es el momento de visitar. Nuestro futuro depende de qué tan... nuestro futuro depende de que estemos saludables, sin tantos visitantes y así poder aminorar los casos. Haremos lo que sea posible para aminorar estos casos positivos. Está en nuestras manos corregir nuestras acciones y tener menos hospitalizaciones y fatalidades. La única manera de hacerlo es deteniendo las acciones que nos lastiman.
Good afternoon. The judge touched on a subject that's getting nearer and dearer to the hearts of everybody, and that is the idea of school opening. And I just wanted to share with the community that we had a great meeting via Zoom or WebEx, whichever one it was, with the independent school districts within the city of Corpus Christi, and I think the county schools and the judge have been communicating as well as within the city. And we wanted to let them know that we were supportive of trying to help them meet the needs and the requirements that they need to meet with the TEA and the state. And they were very appreciative of our effort, and we're going to be getting back together with them at the end of the week to see what suggestions they may have within the authorities that we have to support them. And so, but they were very positive in their meeting and their appreciation of having that meeting. They've got a challenge on their hands, but we said, well, we're here to help whatever we can within the law, and so we'll continue to have dialogue with them. But I came away from that meeting feeling very good about protecting the interest of the teachers and the students and also the concerns of the parents. And so we're going to try to put together whatever they come up with as a group to, if we can help in some fashion or form, to lend our assistance and direction and encouragement to all, because we've got to continue education, but at the same time, our number one goal is the safety and the health of our students and our teachers. And I'm speaking of one whose mother was a teacher, whose aunt was a teacher, whose wife is a teacher. So teachers are important to me, and we want to protect the kids. I have 5 children and lots of grandchildren, so we want to make sure they're taken care of too. So we ask that the parents follow this discussion closely and be explaining to your children what it means to take on responsibility on a personal level, and that is in terms of their health, their safety, they're washing their hands, they're not touching their face, how they kind of get them back in line to start remembering when the teacher says something, you say yes ma'am or no ma'am or yes sir and no sir. The teachers are there to help educate the children, and that's what we want to happen as soon and as safe as possible. So I'll end my comments there and just continue. We're working together on this. We will win. It's just a matter of when, but the more that you cooperate with us and we don't have some repeat incidences like we had this weekend, I think we can move this community forward, and we're looking forward to it. So thank you very much.
Quiero que los superintendentes escolares sepan que los vamos a apoyar en todas las decisiones que vayan a tomar, adhiriéndonos a las leyes. Haremos lo posible por proteger a los estudiantes y al personal docente, ya que la educación debe seguir, pero cuidando de la salud de nuestros residentes.
Okay, I believe that concludes our prepared statements for today. Let me just add one thing, that in our weekly or daily reporting information that we put online, we made an adjustment today to the number of tests that are performed, because there's been a lot of confusion over the past couple of weeks in terms of the numbers. The testing information we get is delayed. There's a lag time. So tests administered today may not be counted until 2, 3, 4, 5 days from now. And so in some days it looked like there was a very low number of tests, but more persons were impacted from COVID. And the general person reading those reports felt it was misinformation or didn't really understand how that could be the case. So what we're going to do, we talked about this a couple of weeks ago, is wait till Friday and then compile the whole week's worth of testing data and report it out on one day. That way, it will eliminate a lot of the confusion that comes in every day, people wondering why there's more persons that have COVID new cases than there are tests administered in that one day. We're still tracking the testing data by day, so if anybody wanted it for some reason, we can provide that to you. But just to try to make it a little more clear to the average person that's looking at those reports online, we'll put the test data on just one day a week on that Friday. Okay, so that concludes our press briefing for today. We can take any questions. The judge and I are here. If there's any questions from the media. They should, yes. The demographics of age and, yes, gender, that type of thing. Yes, they will be. Courtney's question was the statistics on number of tests performed will include demographics that we report today, to include things like age and race and, well, sex anyway, gender, that type of thing. Okay, that's it. Okay, good. That concludes our briefing for today. We'll be back tomorrow at 5 o'clock. Thank you.